We ready to go?
Let's go, David. Yes.
Okay, thank you. Good morning, everyone, and a very warm welcome to today's SafeHabitus webinar on understanding and strengthening mental health services for Europe's farmers. As ever, it's a great pleasure to see such a strong and diverse audience joining us, and we welcome people who are interested in research, policy, advisory services, and farm organizations, as well as practitioners who are working directly in mental health and rural support. This particular webinar addresses an issue that the SafeHabitus project has focused on for quite some time, and it's because it is an issue that is increasingly recognized as central to the sustainability of European agriculture, and that is the mental health and well-being of farmers. So across Europe, there is a growing awareness that farming, while it's very highly valued, also involves a unique combination of pressures, and there are many of these pressures. So these include things like long and irregular working hours, economic uncertainty, social isolation, and exposure to environmental and climatic risks. And that's just a short list. There are many more, of course. In SafeHabitus, we approach these challenges through the lens of working conditions and social sustainability. Working conditions refer to the day-to-day realities of farm work, so not only the physical demands, but also the workload intensity, the time pressure, the financial stress, and very often the blurred boundary between work and personal life, which within farm households in particular, this can be a very challenging interface at particular points in the life cycle as well. Social sustainability builds on this by considering how these conditions affect well-being, quality of life, and the long-term resilience of individuals and farm households. And if you're with us on Wednesday, we considered some of the implications with regard to the attractiveness of farming to the next generation or to new entrants. So within this context, mental health is not a standalone issue. It's closely connected to overall health of the individual, how work is organized, experienced, and supported. However, despite growing recognition, farmers often face significant barriers in accessing mental health services. And sometimes these relate to stigma and cultural attitude around seeking help, or limited availability of services that are tailored or understand agricultural contexts, and then the practical constraints of farm work, which can make it difficult to engage with conventional support systems. SafeHabitus has been very proactive in making the case for European policy to support farmer mental health and well-being, and we've been quite specific about what we think is necessary here. So things like training of farm advisors to recognize farmers who need additional supports and to signpost them to those supports. And also the development of farm relief services so that farmers can take a break if they need to in order to maybe seek care or indeed just get a break from the farm and the work. And our activities in this area have contributed to the proposals that are currently being considered for the new CAP, which include both of these measures that I've talked about here around training for advisors, but also supporting farm relief services. So today's webinar is grounded in the idea that addressing the overall challenges requires learning from practice. And this is why, if we think about these new proposals that are being put forward, we want to learn about the experiences from across Europe where organizations are involved in supporting the mental health of farmers and delivering these services in ways that are accessible, trusted, and responsive to the needs of farmers. So that's the overall background for today. In terms of the house rules, these are our normal house rules. So this webinar is being recorded. We will make the recording available in the next week on our SafeHabitus YouTube channel. We would ask that you keep your camera and microphone muted, well, your camera off and your microphone muted. And please submit your questions using the Q&A function. And you can also engage with ourselves and each other over the chat function during the presentations as well, and share resources, reports or links to resources that you think are particularly interesting. In terms of the program that we have today, we will have a number of speakers followed by a discussion that's going to be moderated by Maida Cernik-Ishnik. And our presentations will start with an overview of the experience from Germany by Sarah Osterk, and then followed by a similar presentation from my colleague Joseph Fernharber, looking at the Irish context. And then we'll move to Finland, where Pavi Valan will talk about the experience there, before we then move to thinking about mental health in a broader context. So here we'll be thinking about both agriculture and rural context, and that's where Deborah Pijevan will come in, and finally we'll hear from Croatia, where Anna and Davor will provide us an overview. So with that, I'm going to hand over to Sarah in a moment, but just to say we will have additional webinars coming up in the next month or so, so please keep a close eye on our website in the event section, and there will be a lot of activity in this space as we approach World Mental Health Day, or World Mental Health at Work Day as well. So that'll be during the end of April. Okay, so with that, I'd like to hand over to Sarah. Sarah, please take the floor, and we look forward to your presentation.
Thank you, David. So I'm waiting for my slides.
Sarah, can you please maybe move the mic a little bit closer to your mouth, if that's possible? Thank you.
Is it better now?
It is, thank you.
Okay. So, hello, my name is Sarah Öztürk, and I work for the Social Insurance for Agriculture, Forestry and Horticulture in Germany. And I'm also Secretary General of the European Network of Agricultural Social Protection System, in short, INASP. And today I will share some experiences from Germany, and especially the services for mental health and well-being from SWLFG. Next slide, please. Okay, first of all, I would briefly like to introduce the SFLFG. We are a statutory compulsory insurance scheme for farmers throughout Germany. We are responsible for the agricultural accidents insurance, including commuting accidents, agricultural health insurance, agricultural long-term care insurance, and old age insurance as a partial insurance system. Self-employed farmers and their family are insured in all branches of insurance with us, and only in the accident insurance we also have the employees also covered within our insurance scheme. What makes us special is not only the one-stop shop character, but also that we are a self-governing public law corporation. Self-governance means that insured persons influence their own affairs through elected representatives. So they make their own important decisions themselves within the framework of the law, not the state. Next slide, please. Now I would like to move on to our activities relating farmers' health and especially mental health and well-being. We have a campaign so-called With Us in Balance, and it includes telephone and online services, group programs, and individual support from experts. On the slide, you can see what these three areas have to offer, and in my presentation, I would like to pick up some of these services and take a closer look at them. Next slides, please. Starting with our telephone crisis hotline. This hotline is staffed 24/7 and consists of a team of experienced psychologists and psychiatric nurses. It serves as the first point of contact in acute crisis, but also in general, and it offers individual solutions not only for the moment, but also for the long term. Callers can, for example, be referred to further services offered by the SWLFG or regional counseling centers. Below you can see the overall development of the call. Blue represents male callers, orange represents female callers, and gray represents undefined callers. It is apparent that the number of callers is rising slightly, but steady, and that the sexes are almost evenly balanced. Next slide, please. Now I have some statistics. These statistics show the call reason 2023. As you can see, family matters are the main reason, accounting for 38.7%, closely followed by mental health with 34.7%. And as you can also see, these two groups account for the majority of calls. In third place, then stress is with 6.8%. The individual areas were then divided into subgroups. For family, the main reason for calls in general are general family matters followed by overload, so as a tense family situation or concern for relatives. In case of mental health, emotional overload is particularly significant, but also grief, distress, and depression play a big role. In the group of stress, workload is particularly noticeable. Overall, we can say overload at all levels stands out when it comes to crises and use of the service. Next slide, please. Here are some recent statistics. As you can see, those are the call reason 2025, and mental health is now the main call reason. Overall, the reasons for the calls and the topic discussed are similar to those in 2023, so we don't have a new trend or something, but you can see the raising of the calls. And the same applies to the gender breakdown of the calls. It's equally evenly balanced. Next slide, please. One slide back. I think it's, yeah, yes. As the crisis hotline has shown, workload and general overload are significant issues. Services must therefore be tailored to the individual life and work situations of the insured group. To this end, the SFLFG offers individual coaching by telephone together with a psychologist who acts as a personal coach. Over a period of about 6 months, ways of dealing better with stressful situations and improving quality of life are developed together. External counseling centers are also involved in the individual and tailored solution concept. Now, next slide, please. Another flexible service is the online health training courses on stress, prevention of depression, regeneration, and sleep. These trainings courses are offered in collaboration with our partner GetOn. They are anonymous and are run on a service online platform which is with a personal trainer. So insured persons can work their way through the various lessons consisting of videos, audio files, text, experience reports, and exercises to tick and complete. After each lesson, users receive a feedback by telephone or online by their personal trainers. The service and all lessons are tailored to the green sector and they are versatile and entertaining. Next slide, please. There's also a seminar on stress management that offered both online and in person. The focus is on the recognizing of stress factors, dealing with them. Techniques are taught to strengthen one's own resources and reduce stress levels. It consists of 8 modules in total. These 8 modules cover understanding stress factors and responses, developing individual coping strategies, reducing stresses, implementing long-term stress and measures, and promoting both physical and mental health. Next slide, please. Another popular service in Germany is the Respite for family carers. During the training, carers receive tips to make their work easier. They have an opportunity to talk to like-minded people and learn techniques for recharging their batteries to their breaks. The aim is to maintain the physical and mental health of the carers. And during this measure, it is also possible to have a person in need of care to look after as a part of the short-term care, respite care. And a similar offer is also available for parents who are carers. And in addition, the SFLFG also offers a digital care roundtable for exchange. Next slide, please. So in addition to the personal and family situations, the SFLFG also offers support when it comes to assessing their risk management in the agricultural businesses on the farms. The aim of the mental stress risk assessment is not simply to evaluate workplaces, rather the task to create conditions that enable healthy and productive work. The strengths and weaknesses of the agricultural businesses will be identified, and participants can identify and assess their psychological stressors in the workplace. So this enables the to assess whether, and if so, which occupational safety measures are necessary and need to be improved. Therefore, the SFLFG offers a seminar and a box with materials to carry out those assessments on the farms. Next slide, please. In order to raise awareness of the issue and to encourage also farmers to engage with it, the SFLFG uses various channels to address the topic of mental health and well-being, especially with voices from the profession, and experience reports are particularly effective. The target group can identify them with these particular very well. So we have those two examples, and on the right side, for example, you see a farmer who is talking about just before he thought about suicide to get help and how he came out of his grief, I would say. Okay, next slide, please. In order to engage politicians and stakeholders in the green sector with the topic, the SFLFG organized a symposium on mental health in 2023. And the main questions were, what challenges exist in the green sector and what measures can we take to counteract them? So from these part, or the questions, those were raised by those affected and the representatives of politics, science, the profession, social insurance, and advisory services. The participants of the symposium agreed that various measures need to be developed. These range from networked counseling and training services provided by the SFLFG, chambers, farmers associations, to campaigns to remove taboo on surrounding of the topic mental health, stress in the green sector, and also research projects on suicide prevention. And therefore, the participants adopted a joint declaration to make this binding. And as this format proved so successful, and the work of these topics should continue, the next symposium will take place this year in May. And the focus there will be on suicide prevention. And among other things, SFLFG will be supported by a contribution also from France, from the CCMSA, which is there the insurance provider, and they have a very solid foundation of data and experience in that topic. Next slide, please. And this leads me to the final experience or best practice, I would say, that I want to present today, and this is the international exchange. This takes place in projects like the SafeHabitus projects or in events like this webinar, but also in networks such as the European Network of Agricultural Protection System. At several meetings each year, the agricultural social security organizations exchange information and current development and services and their respective countries. And together, they or we have developed a document that I want to highlight today. It contains tailor-made services offered by the 5 member organizations of ENASP and services they have developed specifically for farmers and offered and are offered addition to the general statutory benefits. You can view this document via the QR code, and this document will be updated regularly, and again also this year's. So we are already working for the new version and to provide it. Yes, next slide. And now I'm at the end of my presentation, and I'm happy having shared an insight into our proven practices with you, and remain, of course, at your disposal at any time.
Joe, I think it is your turn for your presentation.
Excellent. Thank you so much, Sarah. I'll pop in next. Second here. All right, we all good to start, Gianluca?
Indeed, all good.
Looking good, sounded good? Great. All right. Hi, my name is Joe Fernhaber, and what I'm going to be presenting here is kind of answering the question, how do we or can we in a project? The example from me is going to be in a research project, but this could similarly be also in the design of any kind of community health project. How can we tailor one of these programs to farmers' mental health needs? And I'm going to use examples from my experience working on the Farm Health program, which is what I did for my postdoctorate. The work of this has been trailing out over the past few years. And now we finally had every aspect of that project published. So to quickly overview, what is this project? The leads were from DCU, Siobhan O'Connor and Dunlo O'Hagan. Myself, I was on the project. We had a research assistant, and we also worked closely with Chagask, primarily with John McNamara, but also with Francis Bly and a few others. So the objective of this project was to design a community-based mental health literacy intervention. I'm going to break down what every single one of those means pretty much, but effectively the work plan of this was to do a literature review of burnout in farmers, see what the literature says, to follow that with an online survey on the health literacy and the health risks that are associated with this for farmers. So these could be help seeking or people's propensity to seek help, their substance use of drugs and alcohol, sleep issues, and burnout, as you'll be hearing a lot of these things come up again across mine and others' presentations today. This was to get a baseline of what is the situation that Irish farmers are facing, or at least some. To follow this with qualitative interviews and focus groups on farmers' mental health, literacy, and help seeking. So follow the quantitative with qualitative design, but importantly also to ask farmers themselves what the primary challenges they face are, and to ask farming stakeholders what these problems are, and to ask everyone how to design an intervention to meet these needs. To follow this with following that advice to design an intervention to meet exactly what those needs were as best as we could with our expertise as academics. This intervention, which we ended up calling the 4 R's of resilience, which I'll describe why we chose that name. We piloted and conducted through Chagask discussion groups, which are peer-to-peer knowledge sharing groups that often take place on farms. And then we promoted every single part of this. By promoting, I mean we wrote this up in the scholarly articles you'd expect, but we also made sure to try to work as much with the press and in the ways that we could work with policymakers as well. So this is the overview of the project, and I'm going to go through each piece of it. But first, I want to say, what, Isaac, how do we do community-based research? When we say community-based, what does that mean? I have a quote for you from Lilla Watson. It's, "If you come here to help me, you're wasting your time. But if you've come because your liberation is bound up with mine, then let us work together." Now, this quote, importantly, is originally about very important racial and Indigenous, specifically Indigenous Australian issues, but it highlights some really important principles for community-based research and for addressing the needs of a group. One is that the challenges of different communities in society are interconnected and they impact society. It's not particularly hard to see how the mental health challenges of farmers could have huge impacts on the rest of us. It also illustrates that communities are the experts in their own problems. We, as could be academics, we could be policymakers, we could be people working in Social Security groups, whatever our particular expertise is, we are bringing our expertise, but the communities, at least so community psychology posits, are the experts in their own experience and their own problems. And therefore, solving or addressing these requires being involved with these groups and communities from the very beginning to the very end of any kind of project determined to address those needs. So how did we do this? Well, first, we tried to choose a question and address that question in a way that actually met a need that actually exists. And this is important because if you bring your assumption about what the problems that a group is facing is to that group, and try to fix it without ever checking that it's a real problem with that group, you might not fix a problem that actually exists, and therefore you wouldn't be fixing anything. So the primary assumption of this project is that farmers, like many others, would use mental health services if they understood when, how, and where to seek help. And this kind of fundamental assumption runs through all of the work that, like other occupational groups, like people that live in urban areas, for example, farmers are still people who would access services like others do. And this challenges some ways that farmers have been talked about in the literature as uniquely or kind of specially against help seeking. We drew this from the scientific literature that describes this exact phenomenon and the lived experiences of people in the project who lived in rural communities, who were family members of farmers, etc. I want to highlight that the main variables that we were studying here, the main problems we were trying to address of mental health literacy and help seeking, we also conceptualized as not just individual behaviors, that the norms in people's communities impact how they understand mental health. And that's what I mean by mental health literacy, just how do you understand your own or others' experiences? And they impact the ability of people to seek help, whether they believe it is normal to talk to a doctor about this or not. It's also not individual because the actual service availability of mental health resources and its suitability to farmers, as David mentioned in the beginning, is another large thing that constricts farmers' choices. I mean, if people have very few resources available to them, it's no surprise that they would choose to rely on themselves and their families. So these are the assumptions that we went in with based on the research. So the goal was to first establish a good question to ask. So the online survey, and I'll go through this relatively quickly, each of the subsequent steps, because these steps are just examples of how our project did it. What I've just covered is kind of the principles that your project could follow. So our online survey was basically to establish a quantitative baseline of what farming communities are facing. We identified some widespread occupational issues, such as sleep issues, but otherwise, we identified a small percentage of our sampled population, which was non-representative. To keep that in mind, we didn't sample a fully representative group in Ireland, but about 350 people through an online survey. But we identified a small percentage of the population at a very high risk. For example, most folks had very low substance uses, but there was very unhealthy substance use among a small group. Similarly, most farmers we surveyed would seek help if they could, but most just didn't know how. A minority had very negative views about seeking help. So this picture pans out in a lot of other research that we have done here in Teagasc following on from this, and also panned out in the qualitative interviews. Again, as I said, the function of these qualitative interviews and focus groups with farmers and stakeholders was to do that community-based research value of treating people as the experts in their problems and trying to figure out how we can help address them, how we can work with the community. These focused on farmers' mental health literacy, their help seeking, and how to design this intervention. What came out of these interviews was that farmers were stoic because they felt they were expected to be by their communities, by their families, by other farmers. They saw it as a part of what they had to do to be good farmers. As a result, many farmers are actively trying to seek help and are actually actively trying to improve their mental health or address their mental health or be resilient in the face of changes, just mostly doing this informally, with family, with friends, and through what people describe to us as the therapeutic or beneficial aspects of farming. About the feedback about designing an intervention, they said that intervention should be given by farmers themselves or by people with farming literacy. effectively, if we wanted to help people have better mental health literacy, that should be delivered by someone with some kind of farming literacy, some way of understanding what it is like to be a farmer and how to deliver content to farmers and with farmers. They specifically stressed that getting the language right to talk about mental health was important because, as I just described, people are already seeking help, are already coping, working to cope with mental health challenges, but they might not be using the terms that we would expect. So the community recommended we use resilience as a term to talk about mental health, because that's one way that farmers already were talking about it. So what was this intervention that we designed? Well, following these recommendations, we piloted the 4 R's of resilience, which basically just worked through different principles to identify signs of struggle in people themselves and their communities, how and where they could seek help, and did all of this in accessible, sometimes is a what I mean by accessible language here, I mean just language that people were used to hearing. It's the best way to think about it. This workshop was delivered by a farmer who also had psychology training at these peer-to-peer discussion groups. It was very successful in increasing mental health literacy, as well as help-seeking efficacy, which was another thing that we measured and wanted to improve. This was not just people's understanding of how they could seek help, but their feeling that they actually could if the need arose. This was as compared to a control group, which simply received our workshop after they completed all of the scales that we were using to measure the effectiveness of it. In interviews after this intervention, people also described that this intervention helped address the stigma around mental health, at least for them. They felt that after participating in this, they'd be very happy to recommend that others participate in it. And so what we did here wasn't particularly revolutionary in any way. And we kind of meant it, we designed it in this way. We wanted to do something that was very well proven. These types of mental health literacy workshops are pretty widely done, but we wanted to just do it in a way that farmers would be able to be involved with it. And how we did that was by following their recommendations. So not just in doing the work, like doing the work with the community is good, and helping those people who participated in the intervention is of course good, but of course the goal of a project like this is to make much larger impacts. So other than the direct technical report back to policymakers, who were the funding body for this project, that's the Irish Department of Agriculture, other than, of course, putting out the scholarly articles that we wanted to from this to inform wider research in this area, as well as a EU OSHA report, which is really good European level impact, we wanted to make sure that we were communicating these findings back to farming communities, especially since the conversations were useful in addressing some stigma against help seeking. So we tried to get on radio. We had several different radio spots, several different press releases through DCU. I've worked on a few Chagas publications around this. Further, the folks at DCU, the project leads, have continued this project, focusing not just on farmers, but looking at farm families' health as well in their follow-up project, Farm Fam Health, which you can find information for. And this work that I was involved in across this whole thing, I was working on designing the intervention and running all of this research and doing the focus groups and doing the analysis across the whole thing, has informed my work now with SafeHabitus and the approach that we've taken to, for example, our work to examine the causes and consequences, high level, low level, immediate, political, and all other influences on farm safety that you might have seen at the webinar almost exactly 1 month ago. And we also have worked to communicate this to EU policymakers and stakeholders. This was through my attendance at a EU CAP Network event, but also across other times that we in the SafeHabitus project are in Brussels, we're trying to communicate the work that Chagas has done here on mental health to policymakers as an example of how you can work with communities and not just try to provide solutions to a problem which may not exist for them. So that's a quick breeze through, and you can of course reach me at my email or in questions afterwards. Thank you so much.
Thanks a lot, Joe. Perfect with the timing. And I think now we can move on with our experience from Finland. So, Päivi, please, the floor is yours.
So thank you very much and good morning from Helsinki. I'm Päivi Wallin and I'm here on behalf of the Farmers Social Insurance Institution, MELA. MELA is responsible for farmers, reindeer herders and fishermen's pension insurances, occupational accident and illness insurances, as well as preventive measures to support farmers' workability and to prevent occupational accidents and illnesses. And we also organize farm relief services for Finnish livestock farmers. And in this webinar, I'm really happy to share an overview of our early support services for farmers. These services are designed to strengthen farmers' workability and help ensure longer, healthier working careers in agriculture. Let me start with a bit of a background and where the early support services come from. The roots of this service lie in the support of the Farmer Project, which ran from 2017 to 2024 as a national development initiative. During those years, it became clear that the need for this work was permanent. As a result, the project activities were made permanent on the 1st of December 2024, when the early support services were formally established by the law. Responsibility for these services was assigned to MELA under the Farmers' Pension Act, so-called MYEL. The project measures were also considered to align well with the government's broader security policy and guidelines. Actions that strengthen food security are widely supported in Finland, and the current global instability has highlighted just how important food security is. Studies on the support of the Farmer Project showed that these services improve well-being and workability of farmers and strengthen both farm-level resilience and national goals such as food security and preparedness. Early support services are targeted at people insured under the Farmers' Pension Act. That means farmers, reindeer herders, and fishermen. The goal of the service is to strengthen workability, to prevent disability and premature exit from working life, and to support longer and healthier careers. The services are funded through the state budget, approximately 2 million euros per year. And finally, it's important to emphasize that for clients, the service is free of charge and strictly confidential. Let me walk you through what the early support services include. The contents of the service are defined in law, and they consist of 4 elements. The first, and really the heart of the service, is the workability advisors services. MELA currently has 14 advisors across Finland, and they provide professional guidance and tailored support for clients facing different challenges in their everyday work and well-being. The second element is the vouchers for mental health expert services. These vouchers give clients access to external mental health specialists when deeper support is needed. The third element is the maintenance and coordination of the early support network. This network is built together with regional partners to ensure farmers' workability concerns can be identified early and addressed at the right time. And finally, we offer training, communication, and digital services related to workability. These tools and learning opportunities help build knowledge, strengthen early intervention practices, and give farmers practical ways to monitor and support their own well-being. Next, I'll explain the role of MELA's workability advisors. MELA's advisors provide comprehensive practical support to farmers. They start by mapping each person's situation and then work together with the client and with necessary experts to find the best possible solution. Our advisors have deep understanding of the agricultural operating environment as well as a wider service network in society. This means they can guide clients efficiently and help them access the right support at the right time. And importantly, anyone can get in touch with an advisor. They can contact us themselves or together with a family member, a friend, or a trusted stakeholder. The threshold is intentionally low. Sometimes conversations with our workability advisors are not enough on their own. In those situations, Mela can issue a voucher for mental health expert services. These vouchers can be used for appointments with a psychotherapist, psychologist, psychiatric nurse, or psychiatrist, depending on what the client needs most. Each voucher has a maximum value of 500 euros, and clients can receive up to 2 vouchers within 5 calendar year period. This gives farmers a low threshold way to access specialist mental health support when it's needed. According to studies, this type of short-term therapy has been shown to be effective when it's received at the right moment. Let's look at the early support network. This network brings together stakeholders who work closely with farmers. That means farm advisors, farm relief services, veterinarians, occupational health services, and so on. They see how people are coping in their daily work, and they play an important role in guiding producers toward available help when needed. The goal of the network is simple but crucial: to lower the threshold for farmers to seek help with workability concerns, and for network partners to bring up their observations about farmers' coping and well-being. To support this, Mela provides training for network members on the early support model. The training covers how to recognize risk factors that may threaten farmers' workability, how to raise observations in a respectful and constructive way, and how to guide the person toward the right services. And it's important to emphasize that all guidance is always given with mutual understanding and consent. Nothing happens without the client being fully involved. Alongside our advisory work, we also offer training, communication, and digital tools that strengthen workability and help to prevent disability. Workability ABC training provides practical tools for proactively promoting workability. After completing the training, participants gain an understanding of what workability consists of, which factors influence it, and how workability can be actively managed. Through the Strong Mind coaching program, participants are guided to develop their strengths as agricultural entrepreneurs. The coaching is delivered remotely in small peer groups. The sessions focus on strengthening confidence, hope, optimism, and resilience. Through these exercises, participants are supported towards sustainable occupational well-being. And we also offer a Strong Mind coaching, a coaching program delivered. I'm sorry, I already told about that. And finally, we have the Farmers Workability Scale, a digital tool that allows producers to assess their own workability and spot early signs of strain. it also recommends services that may be helpful in their situation. These are just a few examples of our training, communication work and digital services that we offer for farmers. And I'd like to take a moment to explain the farmers' workability scale in a bit more detail. Finnish farmers consistently rate their workability lower than many other professional groups. To respond to this, we developed an online tool for assessing workability, the first of its kind. Our goal is to encourage farmers to pay attention to their workability throughout their entire working careers, not only when they start noticing a decline. The farmers' workability scale allows producers to assess and monitor their own workability, occupational well-being, and safety while taking into account the realities of professional farming. Based on the responses, farmers receive a personalized feedback along with recommendations for suitable workability services provided by Mela. What truly makes this service unique is that the users can compare their results with those of other farmers of the same age, production sector, and gender. The innovation lies in the comprehensive reference data behind the tool, and this data updates in real time as more farmers participate. So what we aim to achieve with workability scale, as we know, agricultural work exposes farmers to both mental and physical risk to their workability. The work is accident-prone, heavy, and mentally demanding. Compared to other occupational groups, farmers have a higher risk of experiencing more accidents and entering into disability pension. Therefore, it's important to develop services which aim at preventing these occupational risks. The main objectives of the farmers' workability scale are to raise awareness among farmers about their workability and the risks of the occupational accidents at work, and to guide them to appropriate services. And the same objectives actually apply to all our early support services. And together, these services make it easier for farmers, reindeer herders, and fishermen to recognize challenges early and to take action before the problems escalate. Thank you very much.
Thanks a lot, Päivi, for your presentation. I think we can now move on from Finland to Italy, and we have Deborah. Sorry, spotlighting. Okay, we have Deborah Piovan from Accademia dei Georgofili, council member. Her intervention is titled Mental Wellbeing in Agricultural and Rural Contexts. So please, Deborah, take the floor.
So good morning, everybody. Thank you for the invitation. I'm very happy to be here to talk about this issue. I'll try to describe the situation regarding farmers' mental health in Italy and what is being implemented, if anything, to take care of it. So first of all, I am a farmer myself. And as you mentioned, I'm also a member of the Council of the Accademia dei Georgofili, which is the oldest scientific academy in the world to deal with farming and agriculture. It was founded in 1753, and it's based in Florence. I mention this because the debate on farmers' mental health in Italy is a bit lagging. And last year, our academy decided it was time to open a broad discussion. So we organized a public conference with researchers from the National Council of the Order of Psychologists, from the Prevention and Protection Unit at National Council of Researchers. We also had Professor Noel Richardson from Southeast Technology University in Ireland, seeing as Ireland is so advanced on the discussion and on initiatives on farmers' mental health. We also invited experts on the overloading bureaucracy And all of this was in cooperation with a farmers magazine, which is very sensitive to the issue. So today I'll give you an overview of the results of this meeting, of this conference. And I think I can start by saying that in Italy, mental health in agriculture is an underestimated topic. So I will be unable to bring solid examples of good practices. There are, of course, social and health insurances, but we are here looking for something more specifically dedicated to mental health. There's not much of it. What emerges clearly from data is that the rate of distress in this category is higher than the average among workers in other economic sectors, while at the same time, agricultural workers and farmers tend to express their distress less than others, as already mentioned, mainly for cultural reasons related to identity, maybe also to gender. It is very often an untouchable subject, hard to admit. The topic of psychological well-being in agricultural and rural contexts is still rarely debated, but it represents a genuine emergency. Suicide rate is higher than in other categories. And this occurs despite scientific literature agreeing on one point, that living in green and pleasant environments contributes to mental well-being. So there must be specific hardships linked to agricultural work and the context in which it is carried out. Many of the vulnerability factors are have been already mentioned, and these are work overload, isolation, the burden of climate change and consequent yield and production uncertainties, economic uncertainty, the stigma on this issue, the difficulty of talking about it, especially among older men. The European Commission itself has acknowledged the high suicide rate in the sector, the poor work-life balance, the high regulatory costs. Warning signs of distress to watch for include mood disorders, anxiety that paralyzes decision-making, sleep disturbances, irritability, changes in behavior, changes in eating habits. We also need to stress the well-known correlation between alcohol consumption, wine included, and mental disorders and other pathologies. I want to put stress also on a frequently overlooked issue. Myself being a farmer, the heavy administrative burden on farmers, on the technicians and professionals that are working in this sector. Between compliance obligation, the red tape involved in accessing public support, such as the CAP, the Common Agricultural Policy, poorly functioning softwares. Well, farmers are increasingly giving up or even closing their businesses. It's a trend that ends up fueling the population of rural areas. They also lament unreasonable, absurd, often not even evidence-based requests from several different controllers that are felt as humiliating, disrespectful of the expertise of farmers and their advisors. Maybe this is why they ask for advising from people who know what farming is. There is a chain of complexity involving regulatory inflation, excessive bureaucracy, too many bodies with no or little interoperability, and the complexity that does not originate in Brussels only, but often also within the member state itself. Ultimately, it is estimated that as much as 18.3 of the CAP resources are eroded before they even reach the farmer. It's a staggering figure that leads to frustration and resentment among farmers. In our conference, we also addressed the fact that science is under attack. We featured 2 video messages from biotech researchers from public universities who presented their work on developing disease-resistant crops that would require less treatments with agrochemicals. The field trials of both research groups were destroyed by anonymous vandals. And the speakers, the researchers, described the psychological impact that seeing years of work destroyed had on the students working alongside them, and on themselves, of course. And I might add that this too contributes to the distress felt across the agricultural sector, which find itself branded as a polluter, while being denied access to innovations that could support both economic and environmental sustainability. So there is a frustration, a pervasive feeling of humiliation that is still overlooked. Public opinion often perceives farming practices as harmful to the environment, to the consumers, not necessarily basing this perception on sound scientific evidence. This causes alienation among farmers. The fact of working in specialized industrial and conventional agricultural production, pig farming, dairy production, cattle breeding, or in general conventional crops, is associated with greater exposure to psychosocial risks compared to, for example, organic farming, because there is a general unquestioning belief that the latter is more sustainable, even though that is not always necessarily the case. The Italian National Council of Researchers has been collecting data on rates of stress, anxiety, burnout, depression, and suicide. And the data show that 25% of farmers are experiencing burnout, 20% display depressive symptoms, and the suicide rate is 40% higher than in other categories, 100% higher among elderly farmers. Financial insecurity creates the greatest uncertainty. Issues such as economic policies, market pressure, access to credit, also reduced bargaining power are all factors that increase the risk of depression and despair. And the data collected show a rise in pathological anxiety among those converting to organic farming too, linked to production instability, uncertainty, whereas those who made the transitions many years ago and managed to find a way to stay consistent with it report greater well-being. Furthermore, there is a mounting distress arising from the adoption of digital technologies because these bring a greater cognitive workload, a sense of loss of autonomy due to dependence on external providers. We should maybe include mental health impact assessments in discussions on every new technology concerning the agricultural sector. We also touched on the psychological problems faced by migrant workers. These are linked to cultural and language barriers, often to irregular employment, to isolation, separation from their families, and this leads to frequent substance abuse and addiction, particularly in the use of stimulants to work longer hours. So we had an incredible feedback on just this one conference from farmers, from professionals that work in the agricultural sector. And this means there is a great need for a discussion meant to raise awareness among farmers, to reduce stigma on mental health. What can be done? Well, I learned a lot this morning, but anyway, talking about it is definitely the first step in order to help farmers see that mental health is not a forbidden topic. It is a thing. And to help them recognize the symptoms in themselves or in others, most of all, help them understand that these are not a weakness, that we have a right to mental well-being, and this is maybe the hardest part. So to conclude, we believe that the conversation on awareness is open at last in Italy. Now, public health systems and farmers' unions should step up now to address this stress, to put in place solutions that both prevent and resolve it. But in general, we need a deep cultural evolution on how mental health is perceived especially in a sector like farming, where age, maybe masculinity, the need to show strength, and a misunderstood sense of resilience that's been mentioned earlier, well, they all play a significant role. Thank you.
Thanks a lot, Deborah. Thanks a lot for this speech and for taking the time to describe the situation in Italy for this specific topic. I think we can now move to the experience from Croatia. We have Ana Mamic and Davor Moravec. I always hope to get the name right. I will put you on spotlight for okay. And maybe Anna Maria, if you can share the presentation. Yeah, I can find them. There it is. Do you want to start, Anna, or shall Davor Moravec start?
I will do the introduction, and then Dr. Moravec, he will give the clinical perspective.
Perfect.
So I will try to
Thanks
be
a lot.
short. Good morning, everyone. My name is Ana Mamic. I'm manager of Lag Bura in Croatia and member of the EU CAP network thematic group on the mental health of farmers and agricultural communities. Also member of the steering committee for Youth in Leader by ELARD. Today, I want to share with you what we are seeing on the ground in Croatia and a short insight into innovative pilot project we are building to respond to it. After me, Dr. Davor Moravec, he's voted the best psychiatrist in Croatia for 5 years in a row. He will give you the clinical perspective, and together I hope we paint a complete picture. Next slide, please. When I joined the EU CAP network thematic group, I had the privilege of studying initiatives from Ireland, France, and other member states, which had strong telephone helplines, peer support programs, dedicated funding stream. It was impressive work. But when I looked at Croatia, I realized our challenges are different and in some ways more severe. Imagine living in a small village between Zagreb and Osijek. There is a distance of 300 kilometers between you and the doctor. There is no psychiatrist nearby. There is no psychologist. So if you're struggling perhaps with stress or failed harvest, raised fuel costs, your only option is to travel for hours to a hospital or wait for months for an appointment and afford the transport to basically get there. And that is even before we talk about stigma. In farming communities, mental health is still very much a taboo. Farmers, they don't want their neighbors to know they're struggling. They fear losing respect, losing standing in the community, so they stay silent pretty much. And we also have the seasonal agricultural workers, many of them foreign nationals. They face a language barrier. They are basically invisible to the system at the moment. Croatia's 2021 consensus confirmed that what we already feared: extreme depopulation across our border regions, mountain areas. People leave, services follow them. The rural communities are left behind. They are the most vulnerable and the least served, basically. Next slide, please, Ana Maria. Thank you. So here we have the numbers. In Croatia, 774,000 people are affected by mental or other health disorders. That is 20% of the population, and according to WHO data, Croatia ranks third in Europe for the prevalence of chronic depression, which is not a minor public health issue. It's a national crisis, basically. And it's concentrated in the rural communities that are already the most isolated and the most under-resourced and the most overlooked. We are lacking 600 psychologists and face extreme long waiting lists even for the general practitioners as well. So we have quite a bad situation in Croatia at the moment. So next slide, please, Anna-Maria. So we can go on the next slide. Oh, thank you. So basically, what do we do? We developed an idea and a concept for a EU pilot project that brings accessible, stigma-free mental health support directly to rural communities instead of expecting rural communities to come to the system. A telemedicine platform that allows patients to book appointments with a general practitioner, a psychologist, or a psychiatrist online from their home without any traveling. It's all in the planning stage. Secondly, we would aim for the training for the community nurses. In rural Croatia, community nurses are the people, the most trusted person in the village, basically. People will tell them things they would never tell a doctor or other person. We want to equip those nurses to be the first line of the mental health support, to be trained, confident, and connected to the wider system. And basically what would we plan and what we lack is language support, to involve international doctors, translators, to serve the foreign seasonal workforce and also the current workforce in agriculture in Croatia. And we want to develop a local digital health structure, a foundation at the community level so that these services are sustainable, not dependent on patients traveling to the city, basically. And next slide, please. So what do we expect to achieve? We want to break the taboo around mental health in farming communities, to normalize asking for help. We want to increase trust and satisfaction among rural patients. We want to reduce burden on already overstretched hospital system. We want to build a genuine resilience in the agricultural communities facing climate change, economic pressures, demographic decline. And the most important, this model is scalable. What works in rural Croatia can work in rural Ireland, Slovenia, Romania, Portugal, any EU country. So that is our plan for the future, hopefully, and we are trying to make an initiative about it, and we will let you know about the results when they happened. I will now hand over to my colleague Davor Moravec, who will bring you the clinical and psychiatric perspective from the ground. Thank you very much.
Thank you. Good morning, everyone. My name is Davor Moravec, and I'm consultant and addiction psychiatry based in Zagreb in Croatia. And I would like to show you what this ongoing pilot program we try to establish. And as now, we have a comprehensive hybrid model of care structure to improve mental health and support for agricultural sector. Next slide, please. It is important to note that the initiative is not opening in vacuum. We are providing a practical modern delivery tool to achieve the health and resilience goals that the Croatian government already wants to achieve. Next slide. When we look at the European statistics, we see the stress levels exceptionally high in rural communities, and especially for the farmers over the age 64, 65. Rural environment struggles often with the mental health literacy and deep stigma problem. Because of isolation, our opportunity is not only to offer treatment, the real opportunity is early intervention and creating a lower friction, highly accessible entry point into the healthcare system. Next slide. So we have a problem with stigma, access friction, and often help arrives too late. People only reach out when a crisis hits, especially in Croatia. As Anna said, we have few hundred kilometers until the first access point. And in Croatia, most of psychiatrists and psychological care is based in the big hospitals. We have enough hospital beds, but not enough locally available mental health providers. What we have a problem now is the multicultural problem, multilingual problem. We have workers from out of the Europe societies and people from Nepal or India or Philippines don't have even translators. In Poliklinika Moravec, we provide the basic brochures, online, digital, freely available for now, for those people, and multicultural and multilingual help is available in few, for now, European languages. Next slide. What I am talking is hybrid model. We know that only telepsychiatry is not good enough for most of the serious situations, so very comprehensive and robust triage model is what we do. We have a telephone dedicated system when people could reach, and then we could manage them in the system, and during the triage period we find out what is the best approach. Psychological evaluation, also psychometric evaluation is available by us, and then we will see strongly with GDPR compliance and strict data control what we could provide for a specific client, and we could tailor a therapeutic plan for complex problems. Next slide. We could not do everything by ourselves, so the consultation with local teams, including family doctors, is necessity. We are trying to design secure system co-created with the domestic experts and ensure that patients are seemingly guided to the physical care when they might need it in their own communities when we see that it's needed. Next slide. With our ongoing pilot run via telemedicine through Poliklinika Moravec, we provide very wide range of services, far beyond simple consulting. Because of mental health is deeply tied to this physical health and mental medical history, Our clinical team conducts reviews and monitoring of pharmacotherapy. To ensure patient safety, we also integrate the routine monitoring of lab results and check any potential side effects of medications. Furthermore, our specialized team is equipped to handle complex cases. This includes dedicated trauma therapy for those who have experienced severe accidents or personal tragedies, as well as evaluation and management of addiction problems, which unfortunately can be prevalent coping mechanisms in isolated areas. We also measure everything from completion rates to clinician time saved to provide this model works safely before scaling. We try the most comprehensive European standard measuring tool like quality index, client quality index, or scaling digital tools we are developing, and before we implement it on the broader spectrum, which could be scaled also in other environments, we need to be sure that every tool we develop is secure and also completely validated. Next slide. In the conclusion, we are stronger together. This pilot provides that by combining digital triage with a hybrid model, deep clinical expertise, and local integration, we can reach people earlier and improve mental health. This is practical, scalable step forward for creation of rural health policy. Thank you for your time and attention today. I invite you to review our ongoing work at Polyclinic Moravec, and I am open to any questions you may have. Thank you.
Thanks a lot. Thanks a lot from our for our colleagues from Croatia for this interesting presentation. We now move on towards the ending of the webinar, and I would give the floor to Maida for some potential conclusions and to manage. Let's say I see there are a couple of questions here in the specific section. So please, Maida. Thanks a lot.
Luca, thank you very much. I would like to thank all the speakers for these highly informative presentations. What I found particularly valuable is that although the cases come from different national contexts, they highlight several shared lessons that are highly relevant across Europe. Based on my research experience in this field, I would like to highlight 3 brief conclusions. First, the presentation reminds us that farming's mental health cannot be treated simply as an individual health issue. It is closely connected to the broader conditions in which farming takes place. When we speak about stress, anxiety, exhaustion, or emotional strain among farmers, we are also speaking about workload, economic uncertainty, administrative burdens, market volatility, weather-related risk, family responsibilities, and often also social isolation. In other words, mental health is deeply embedded in the everyday realities of agricultural life. This is why strengthening mental health support is so important, but also why it cannot be approached in a narrow way. If we want to understand distress, we also need to understand the context in which it emerges. Second, one of the strongest lessons from today is that effective support is not only about existence of services, but also about whether those services are trusted, accessible, and adapted to the realities of farming. In agriculture, trust is absolutely crucial. Many farmers may be reluctant to seek help, not only because of stigma, but also due to time pressure, distance, lack of tailored information, or a sense that available services do not really understand farming life. This is why successful initiatives often rely on trusted intermediaries and local connections, people and organizations that already have credibility within farming communities. This may include advisors, veterinarians, farmers' organizations, local networks, peer contacts, or community-based actors. So the key question is not only what kind of service exists, but also how support reaches farmers, through whom and under what conditions it became accessible to use. Another observation is that the European exchange of information and best practices is extremely valuable, but it must not stop at merely citing examples. We must also consider what enables their transfer. Good practices cannot simply be transferred from one country to another. It is important to understand why they work, under what conditions, and in which context. Some principles may be universally relevant across Europe, such as building trust, raising awareness, cross-sectoral collaboration, and reducing stigma. However, the concrete form this principle take will depend on existing social and health system, advisory structures, funding models, institutional frameworks, and social conditions in rural communities. Therefore, the true value of exchanging good practices lies not only in inspiration, but also in studying and learning how to adopt, transfer, and sustain promising approaches in different contexts. So, in this regard, perhaps we can start our open discussion. As I see in the chat section, there is already questions which we can address to highlight this. I will start with the first question, which was already posed 1 hour ago, from Ines Yerney from Austria. She asked, I think that it was the question related to Sarah's presentation, how well are stress management seminars received, and are they preferred in person or online? She said that we see that it is often not easy to motivate farmers to attend such courses.
Oh, thank you very much for that question. I think, do you hear me? Yes, I hope so,
Yeah,
because I heard
yeah.
some voices. Okay, I don't have the numbers for that courses because I'm just the international relations officer and not the expert in that field. But what I know is that some people prefer in-person seminars, but they are not offered throughout Germany. So it depends a little bit where you are, and if you have a course on your side in your region, then of course in person I think could be more interesting than the online seminar. But if you don't have something in your close region, then they will use the online service. But if you are interested in concrete numbers, please reach out for me again, maybe through my contact data, and I will provide you with some numbers.
Yeah, thank you, Sarah. I see that there are several comments from Ines Yerney, but they are not actually the questions. Well, there is a question maybe addressed to David, how the Yernea Ines from Austria also can participate in our project SafeHabitus. If there is any ways to this in the final year, to include also contributions from other experiences not related directly to our partners in the consortium.
Okay, thank you very much for that comment on the question. This is something we're very interested in doing in terms of broadening out the network that we have. So we have a number of events coming up, but I think the most relevant here might be our end of project conference, which will take place in the first week in November. And the call for that will go out very shortly. And there will be a number of ways to participate. So obviously we will have academic papers, but we also want panel discussions. So we want practitioners and those who are engaged at the coalface to also participate in that event. So that's the most direct way that I can suggest right now. But I'll also continue thinking about this, and we'll look for other opportunities as well to engage with people throughout the rest of this year. Thank you.
Yeah, thank you, David. I have one question for all speakers. Actually, based on your experience, what is the single most important factor in making mental health support truly reachable and acceptable to farmers in practice? And what has been the most challenging aspect to implement? Maybe, Joseph, you can give some words, please.
Yeah, thanks. I'd like I have the same answer for both of them, because this is also I responded to the question in the Q&A with this answer, but I think it's worth saying that I think bringing the service to people is both, in our experience at least, the most useful, like the most likely to make a big difference in terms of increasing access, increasing, accessibility, and also the most challenging, largely because it requires a lot more resources. It requires either more staff, or it requires more funding, or more time, especially. It requires more engagement with the communities in order to understand where can you bring these services. There's been a lot of good examples across the literature in recent years. My colleague Diana brought heart health checks to situations where people were already receiving them, where people were already in an area where they were spending time hanging out. This could be at agricultural shows, for example. This could be at marts. People have done marts in the UK as well. So bringing health checks, mental health can work similarly, to an area where people are already spending time and already congregating is going to be better simply on the busy schedule that farmers have, not even talking about anything else, but just on time, than in asking them to take time away to go somewhere else. So that's just a quick example, but I would say it takes a lot of resources, but it's worth bringing the services to people where they are already spending time and already engaging.
Yeah, for sure. To saving lives, it's very precious that these services are in place and offered to people. Maybe Pavi, you can give us also some of your experiences in this regard before you are leaving.
Thank you, Marja. Yes, I quite agree with Joseph. I think it's important to make the services easily available. And I think in our case, it's important that we have the regional workability advisors, and they are easy to contact, and kind of it's important to keep the threshold low to contact these people who are helping with these issues. And it's also important that the mental health issues are discussed widely also in agricultural sector. I think we have had this discussion going on since more or less 2010 with several mental health projects starting at that time. And first, I think farmers were not that eager to attend all these events and discussions and seek for help. But when we kept on repeating these issues in the media, and we had good examples, for instance, farmers who were willing to share their own experiences and show examples how this kind of mental health issues can be helped, and so with that discussion they were not that not more as much taboo as they had been previously. I think that's important to make also mental health issues as normal as any other health issues also among farmers, and I think that's a long way to go, but I think we are at least halfway on that better direction. So the mental health issues are more or less now normal issues in Finland.
Yeah, this is, I think, very great success that it's open topic in the public, not hidden as it is still in many other European countries. Maybe the colleagues from Croatia can say something about this as well, how they face the difficulties, but also the successes in their ongoing project.
Yes, if I may.
Yeah.
The problem is for sure caseload, of course. My personal caseload, it's about 1,600 clients. So that's a lot. And the waiting list is for sure one of the biggest problem for any kind of services. So the approach to make digital platforms for triage is, for my opinion, necessity. We have very big problem with psychologists, psychiatric help. We don't have enough psychiatric nurses at all. We have local help, also problem. So making access point is, for me, one of the way to go.
Also, I would like to add, because I have like this terrain experience from the local action group, so I deal with farmers a lot in my work. They're very, very skeptical about asking for help because they don't want their neighbors to know, even their families to know. But I have noticed that as most of places, there's much substance abuse. Sometimes even when people come in our office to ask some information about like tenders and stuff like that, you can smell alcohol basically on them, but they're too afraid because of the stigma to ask for help. And that's why I also agree with Dr. Moravec that the telehealth medicine is basically would be the most helpful and easiest way for them to get some help.
Yeah, thank you. Sarah, would you like to say something additionally from your experiences on this?
I would say what you mentioned already in your summary is trust is very important. And what we also recognized in Germany, also within our project, that sometimes farmers didn't know about our services. So we are very busy making our services popular, or advertise them. I think that's also a point we are thinking about in Germany.
Yeah, so to bring the service close to the people. Yeah, this is, I think, it's a real issue, and also the support of other actors in the society is also very important to understand that mental health of farmers is really strategic topic related also to the well-being of other professional groups, not only farmers. So everything is very much connected. We are depending on each other very much. So we need to keep eye on all of us and react when it is really needed. So maybe I can close this very interesting and valuable webinar with these short words that the strengthening of support for farmers' mental health is not only about expanding services, but also building support systems that are less that is low treasured, that is trusted, that is well connected and rooted in the lived realities of farming and social understanding of it. So I would thank you very much for your participation. I would greatly would like to thank to all the presenters with their very valuable information and insights. And also I would like to thank all the participants who joined us in today's meeting, and hopefully that we were able to give another stone in understanding the life of farmers.
Thanks a lot. Thanks a lot, Maida. Thanks a lot, everyone, for taking the time to attend the meeting, and to for the speakers, of course. And I hope to see you soon, and that we can stay in touch further discussing this topic in the future together. Thanks a lot, everyone.
Yeah. Bye-bye. Thank you.
Thank you. Bye-bye.
Bye.
Thank you. Bye.
Bye-bye.
Thank you.
Thank you.
Bye.